So Sage Transparency 1.0, if you will, we launched it in May of 2022 when the fourth round of the Employer Price Transparency Project, or as I would call RAND 4.0, was launched. We took a lot of feedback from everyone. We had it offline for the last 6 months. I should say with Sage Transparency 1.0, we had 37,000 user sessions in 1 year. So people were using it from all over the country. We don't collect any information. I don't think it was 37,000 from one person, but you know, we don't get state information, we don't have username, we don't have login information. We truly believe that all of this, you know, all these prices and quality need to be transparent. So we started building Sage 2.0, and that's what we're launching today, and I'm really excited about it. We have over 4,000 hospitals in it. We have over 2,000 ambulatory surgery centers in it. And we also added medication price transparency for the first time. And we have it organized by health systems and states. We also added a legislator tab, which we're really excited about. Oftentimes, to have a more transparent, honest conversation, that legislators need to know, like, how are their hospitals doing? Many of them, especially in Indiana and across the country, are in rural communities. And their hospitals are not typically the high-priced hospitals. It's the large hospital systems. But they get thrown out in front, if you will. Oh, the rural hospitals are going to close. So we need to just have more transparency in that space. So the legislator tab is kind of cool because now they will be able to see how their hospitals are doing by name. And we did this for every legislator in the country at the state level and at the federal level. So that's my introduction to that. So the problem, you know, people are like, what problem are you trying to solve? I mean, we know there's a lot of variability from looking at Chris Whaley's work. There's a lot of variability in prices. We've heard that there's an opportunity to shop for care in a better way and look for value. But every employer and every person wants to go to the best quality at the best price. We don't just want to go to the cheapest price necessarily. So we have to have quality transparency in addition to price transparency. We really focused on that in the Sage 2.0. We tried to bring in a lot more quality information. There's always room to grow in the quality space, but this is publicly available information that we brought together and want to share that with folks. We also just want it to be easy to use. So it's the easy button, as some people call it, and it is the easy button, and that it's by design. But I will tell you, there's a lot of work that goes behind it to make it easy. Okay, so I think here's what's in Sage Transparency. So in addition to having PT5, which is Price Transparency Round 5, conducted by RAND, we brought in all that data. They sent it to us ahead of time, so we got it eventually so that we could include it in here. As Marilyn mentioned, we have the National Academy for State Health Policy Hospital Cost Tool. Now, they have a couple of hundred measures in the hospital cost tool, so we just added a few measures. You can certainly go to theirs and see the rest of them. We do have a master spreadsheet where all of it's in. We have quite a bit of quality data from CMS, so we have not just overall hospital quality rating, we have patient experience, and then overall hospital rating actually has 5 domains. So before we had overall and hospital, and now we added a few more, and I'll show those with you. Another CMS program is the Hospital Readmission Reduction Program. That looks at 30-day readmissions. So they are looking at, for 6 different categories, what the readmission rate is for every hospital. Hospitals, it's a pure penalty program. It's from 0 to 3%. So if you are having higher than the national average 30-day readmissions for heart attacks, COPD, knee replacements, heart failure, pneumonia, you are going to get penalized. And it's from 0.01% up to 3%. But that can be millions of dollars because it's not just for those conditions, it's on all their Medicare dollars coming in. So this program's been around for years. So that's a pure penalty program. I just think it could be helpful for folks to know that if they're getting penalized for heart failure, maybe you don't want to go there, right, for heart failure, if that's your... So anyways, a little bit more quality transparency. January Advisors is a new data source for us. They're just a wonderful company that's based out of Texas. They're the ones that did the hard work by putting the analysis together, geo-mapping all the legislator districts with the hospitals. So really appreciate them as a partner. And Quantros Health is owned by Healthcare Blue Book, and they have proprietary quality ratings. They are nice enough to let us use a few of their scores, if you will. They have a lot more in the quality space, but we have 3 readings. Okay, so we also have about 5 other data sets that I'd call supporting data sets, Census Bureau stuff and things you don't care about. So with no further ado, I am really excited to launch Sage Transparency 2.0. And let's see here. There we go. So let me orient you to Sage Transparency. We have 9 tabs across the top. Hospitals, so you can select the state. We have 49 states plus DC in here. It defaults to Indiana, but you can pick any state. It's really important that you don't, this is critical access, CAH. Critical access hospitals are uniquely paid by CMS. They're 25 beds or less. They are kind of in a rural area. They are not near another hospital. So because Medicare pays them more, if you will, you need to compare them to themselves. Okay, CAHs get compared to themselves, and acute care hospitals, non-critical access hospitals, should get compared to themselves. You don't want to compare CAH and acute care hospitals together. And so that's why you have to pick it. Are you wanting to look at critical access hospitals or not? So we're saying no. And it's in alphabetical order, but we have over 4,000 hospitals here that you can select from. So I'll just use this one since it's here. This is Ascension St. Vincent's in Anderson. This is 2022 data. Here's their CCN, their address, just to make sure, the number of beds, which is also something new. But we wanted to have some more information about operating profit margins. And as you heard, that's a key number for us to understand how much they're spending and making on patient care, not necessarily the apartments and whatever else they own. What I used to hear at the State House and in the marketplace is we're losing money on Medicaid. We're losing money on Medicaid. We're losing money on Medicare. We have to charge employers more. We just have to. Or we have to demand that the state of Indiana and other states, that they pay us better. But now we can have more honest conversations, because here in this first graph by hospital, you can see what their payer mix is. So what that means is here is the commercial. So the blue line, this hospital, and we can pick any other hospital, but this one has 28% commercial, but they are making a 58% profit on the commercial side, a 58% profit. Outrageous, especially since their total is 14.4%. I will tell you that a lot of employers that are not in the healthcare industry are so happy with they'd be thrilled with a 5%. Margin, but 2, 3, 4 is typical. Having something above 10%, and we have some here that are over 20%. So they're making their margin on the commercial side almost in every single case. But now we can just have more on. Now, this particular hospital is not losing money on Medicaid. They do see quite a bit of Medicaid at 23%, but they making a 1.22% operating profit margin, not losing money, honest conversations. Medicare, they are, and so on and so forth. So you can go through and you can see how much charity care they're providing. Now, in charity care and bad debt, you don't make profits, so we're not showing anything there, but at least it gives you some information to say, okay, 2.43% of their expenses are charity care, and how much bad debt are they really writing off? Again, this all comes from NASHB, and we're just so excited to put a couple of extra pieces of information up there. Here we have, this comes from RAND, and we have a lot of merged data, but on the hospitals, we just wanted to put everything out by hospital so that you could just print it. And I wanted to say on every dashboard, you can increase and decrease this caret. If you want to print anything off into a PDF, you just hit this button. We do have a purchase data button, super easy, like low prices. We just need to, we're updating Sage Transparency quarterly. So we need to kind of try to do our best to cover our maintenance costs. But here we have this particular hospital. This is total facility plus physician. This is all in, inpatient, outpatient facility, inpatient, outpatient physician. What are they getting? What is their price? So for this particular hospital, it's 326% of Medicare. The system, this particular system, Ascension's system, is 262%. So they're high even within their own system. What is the state benchmark in Indiana? It's 297%, so they are above the state average. And then the national average is 253%. So here we see that they're quite a bit above it. We do this for inpatient facility plus physician and outpatient facility plus physician. Just helps you benchmark them within their own system, within the state, and nationally. This comes from RAND, and it comes from NASHB. Here we have the RAND prices, and then we have the commercial break-even. So again, in Indiana, our commercial break-even is 161% of Medicare, and we're one of the highest in the country. I can show you that later because we have all the states lined up. But if you make a lot of money, you're going to spend a lot of money, right? I mean, that's just, you make a lot of money, you're probably going to get a really nice bottle of wine and maybe a really nice vegan dish, or a steak. So otherwise, if you're operating, if you're not, and we can see that, we're looking that Indiana's high priced, but our break even is high. And somebody showed a picture, Chris, I think, showed a really nice picture of a particular hospital. Some of the hospitals, I mean, the expenses are going to be higher for various reasons. We wanted to give you some quality over time. If you look at quality right here in a moment, and especially since quality measures at CMS get updated every quarter, we wanted to give you 3 years worth of quality data. So here you have 12 data points to say, is my quality improving? Is my quality getting worse? Or is it staying about the same? So this is the hospital overall star rating. 1 is the worst, 5 is the best. This one's been sitting at 3, and then it dropped down to 2, the last few quarters. So again, it just helps you understand. Patient experience, patients are rating them a 3 across the board, which is average. This is breakdown on more quality information. So when you want to look at mortality, does this particular hospital, how are they performing on mortality measures? How are they performing on patient safety measures? How are they performing on readmission measures? So the blue means they're at the same as the national average. Orange means it's unreported, and green means they're better than the national average. So for the most part, you can say, well, same as the national, there is a worse than the national average, which would be red, but this hospital is not worse than the national average on any of these measures. Hospital readmission penalty, this is what I mentioned earlier, that 30-day readmission penalty. This hospital is getting a 1.1% penalty on all the Medicare dollars going to them. I mean, if it would be great for them to work on this because then they would have no penalty. But here you can see what they're getting a penalty on. So they're getting a penalty from chronic obstructive pulmonary disease and heart failure. And, another one, total hip and total knee. But they're not getting it on cabbages, heart attacks, and pneumonia. So again, just a little bit more information. This is the scale that goes with it. Very few hospitals, 0.14 hospitals get 2.51 to 3% penalty. So when you have a hospital that's 1%, that's in this range. They're in the 4.4%. So this is less than 10%. Actually, this is, definitely less than 10%. Again, it just helps you understand that this hospital is in the top 10% for getting penalties. Here's some more quality information. This comes from Quantros, so Healthcare Blue Book. 100 is the best, 0 is the worst, and they're in the 30, 40, and 50 range. Here are prices across the board. We look at prices 9 different ways. I think if you're a physician and the inpatient side, you're like, well, how do our prices compare to other hospitals of similar size? So we have prices 9 different ways, and this is total. We saw this earlier. Inpatient facility plus physician, outpatient facility plus physician. Then we just look at total physician, break that down. We have inpatient physician, outpatient physician. Then we just look at the hospital facility. What is the facility getting versus what the doctors are getting? And then you can break that down into inpatient facility and outpatient facility. And then this is the NASHB break even. So when you look across this, look at this number, 458% outpatient facility. So that is what is driving this particular hospital's total high price the most. Again, just some information. It's not dollars. We want to get to dollars in SAGE 3.0, but right now this is what we have, and this is not charges. This is what employers are paying, commercial employers as a % of Medicare. These are not hospital charges. We added this in case you're curious to know who the legislators are that represent that particular hospital. Maybe you have an issue or something positive to say, you can contact them. As we get more email addresses, we will be updating them every quarter. Okay, that's the hospital page. So 4,000 hospitals. The hospital systems tab. Don't you love that when this happens? Like this worked at midnight and okay. Let's try that again. Okay, I'm gonna do what Sarah says. Try refreshing. Sarah, can you come up here? I don't know. It was, that refresh button. Okay. You can just, stay close. Sarah knows SAGE transparency better than anyone in the whole world. She spends, she's spent hours on it every day for the last 6 months, helping build it along with a larger team. So hospital systems, you can look and compare various hospital systems. Again, it's alphabetized. Do you guys want to look up a system? What system would you like to look up? IU Health? Okay, let's do it. So Indiana. So Indiana University Health. They just happen to be in Indiana. Oh, I left Ascension on, sorry. Well, we could do Ascension, let's do Ascension and Indiana just so I can show you how it compares. So Ascension happens to be in a bunch of states, as we all know. I think they have close to 100 hospitals. We're not going to look at critical access. You will get a lot of hospitals, but the max you can see is 1,000, but there's a bar. And then you can look at bed size. Maybe you want to just look at, larger hospitals or maybe you just want to look at smaller hospitals, but this will give you some information. So what you have here, and I'm going to close that, we built this quadrant. We wanted to say, where's the best quality at the best price at the system level? So green is good, right? So it's low price, high quality. And you can see there are really low price, high value, good quality hospitals that are owned by Ascension. And then there are some that are not, and then there are some that are average. So high price, low quality is in red over here. So that's just some information as well. We got a lot of hospitals here, so I'm going to, just for ease, maybe take off some of these states. Okay, well, I just randomly took some states off. There's still a lot, but okay. So what you have here are all of the hospitals, and this is the total facility compared to the commercial break-even. So we are looking at break-even prices. That comes from NASHB. Here is Quantros's scoring on if they have a high quality score, average score, or a low quality score, which is red. This is some more information on pricing. Again, for the hospitals that we looked at, what's the advantage here is, let's say you have 2 hospital systems in your area, but they own a lot of hospitals. But they're drivable, you can manage it. You can just add them here and say, well, in my area, and we can do that on the next page, you can do it by region. So you can pick your state, pick your region, and then look at it. But let's just, for fun, see what else is down here. So some people like numbers, some people like graphs, so we decided to add all of the information here. If you see blanks, that means we didn't have enough claims data for that particular field in order to display it to be HIPAA compliant. Lots of information here. Okay, my favorite one, let's see. So I'm going to, do you guys want to see how all the health systems compare? Okay, maybe it's on, yeah, the 3-year, yeah. Okay, this is my favorite chart, and it is kind of buried. This was very similar to that, but I was playing around with this last night. Okay, so it's on hospital by state. And what you can do is you can see 2020, 2021, and 2022 prices by system. So you get the idea, are prices going up or are prices going down, or are they staying about the same? This is really important because oftentimes we'll hear, well, that was then and this is now and our prices are better now, but are they really? So this gives you 3-year trend. I'm just gonna pick Indiana. I know Sarah's worried about me over here. She's like, is she gonna do this right? So we have now, these are all the hospital systems in Indiana. It'll just filter. So if you are interested, there's Parkview. Let's see, any other hospitals? So you want IU Health. All the independents, if you wanted to compare all the independents together, you could. If you wanted to compare all the critical access hospitals, you could add it. That'd be kind of interesting to see. Let's add the independents. Franciscan Health and Community Health Network. Okay, so here you go. And what you can do is each one of these boxes, you can make it full screen if you wanted to grab a screenshot. So here we have Parkview's prices since 2020 when they negotiated better prices. It must have been on select prices because overall their prices are going up. Here we see Indiana University Health was holding steady for a couple of years, still at a pretty high level at 315%, but now they're at 336% of Medicare. These are the independents. And they are like 2022 is at 219%. So below the national average, which is great. But here is Franciscan Health, also trending up. Community Health Network, actually, I would say, a little bit down. So kudos to them. And then Ascension Health, a pretty big jump up in 2022. Clinical categories. Let's say you're interested in searching for a CT MRI or childbirth or orthopedic inpatient procedures. You can just pick something here. You can pick the states that you're interested in. Let's just do, Alaska, Arizona, and Arkansas. I don't think we have too many people from there. I know we have people from California. Let's do Maine. Okay, California and Maine. You could be an employer. You've got business in a couple of places. They're oftentimes not geographically. They can be geographically, but you could have it in different places. And then you can pick hospital systems. So these are all the hospital systems. I don't know much about these. I've heard of Cedars-Sinai and Banner Health. Okay, there's too many hospitals here. But let's go to a region now. Lauren, where do you live? Los Angeles? Okay. I'm just going to put Los. You have 2 minutes. There we go. Okay, so let's see what's in. Oh, I undid it. I'm like, now what? Okay. so here's the oh my gosh, look at the variability in prices here. So it's almost, this one is 661% of Medicare for a CT MRI, all the way down to 185%. That's pretty bad. I'm going to get Maine off of here. I just want to see what's happening in California. I wonder, okay. Yeah, it was the California one. So that's an opportunity to think about where to send people or design your benefits to be somewhere down here. If we shop for care, if we shop for value, if we design health benefits to go towards value and incentivize employees to go there, think how much money employers would save and how much money employees would save. So I really don't think high deductible health plans is the way to go anymore. We tried that. That's a total failure. And so we need to work on, coming up with more innovative benefit plans. And Indiana is very high in their high deductible health plan space, but we do have employers that are starting to, do carve-outs, direct contracting, and other types of things. So this is state compare. I will say our legislators know their numbers, if you will. Indiana was 7th highest total. Now we're 8th highest. So while our number is a little bit higher, our ranking is a little bit lower. So that's encouraging. However, these are our neighboring states and their prices remain a lot lower than ours. If you wanted to look, and it defaults to these, you can compare any states you want, but these have all 9 prices and compared to all the states. So that's an opportunity. This is total facility plus physician. I oftentimes will grab this as a screenshot for folks, and then, because I present all over the country, and then we'll highlight it. So Indiana's here. We're 297% of Medicare, all in. Okay, we were 292. So up a little bit, and we are now 8th highest, as we just heard. But you can change this around to be any pricing you want. So if you wanted to see any of the other 9 prices, let's say total facility, what the hospitals are getting, we're 6th highest in the country. And then you can come down here and see who's higher than us. And my friend in Florida called me up. She goes, I just got to know where we are. I'm like, I am so sorry to tell you, you are now tied for first. Yeah, really sad, next to Georgia. So we are a little bit better. We are 6th highest. We were 4th highest, but we're at 341%. So right there. Here are some states that are doing a lot better than us, and many of them are our neighbors, but the average, the national median, I should say, is 269%. So you can just do this all day long and have a lot of fun with it. I really have tons of fun. I'm always surprised. I don't know why. Like, look, what's going on with this one, right? Like, why is it 1,094% of Medicare for this endoscopy procedure? Like, that's just unnecessary when you have all these other options. But you can select the counties. And the reason we put counties here is especially for ASCs, those are outpatient procedures. People could drive, right, to something in their county. And there's a lot of variability in pricing. So that's an opportunity. And there's just more information there on the ASCs. This is new, medications. I just want to explain what these medications are. These are not the medications you pick up at a pharmacy. These are medications that are physician-administered medications. So think infusions and injections in a physician office clinic in the outpatient setting, chemotherapy, IVs, and whatnot. So here are the hospitals that have a hospital system ranking. So we rank the hospital systems. We have it by state level. We did not do it at the hospital level in this round yet. Chris Whaley is still working on that, but he said he may just stop here at the hospital system level because we want to have a large enough volume of, claims data if you're going to start ranking folks. So we might just get more data the next go around and show it at the hospital level. I just want to show you that the prices for the same set of about 50 drugs, look at the variability. It goes from 664% to 79% of Medicare. And then you can see who's got the highest ones on medications. This one's got, and this is not percent of Medicare, so this is commercial prices as a percent of average sales price. So you can look up average sales price. It's just a file that you download, and then you have commercial prices. Medicare pays average sales price, ASP, plus 6%. So it'd be easy to calculate percent of Medicare, but we just did it by average sales price because that's a published file. I should say RAND did that work and gave it to us. Okay, here's some of the state rankings. State level median commercial medication price as a percent of ASP. And look at Indiana's medication prices, 298%. So we're 3 times above ASP and one of the highest in the state or in the country. And that's a real surprise to me to be 5th highest. But Vermont is worse. So I don't know what's happening in Vermont, but this is why we used median and not mean, because mean and median is the same at exactly 208% if you exclude Vermont. But Vermont is an outlier at 628%. So it's worth noting if folks are in Vermont to look at some of their drug prices. Here is a legislator tab. So you can pick any legislator. We have Indiana. You can say if they're a state legislator or a congressional legislator, we'll just pick state. And then it's in alphabetical order. So I'll just leave it at where it's at. And now they can just print their PDF page. They can just export it to PDF and print it. It'll say Indiana's 8th highest. It shows which hospitals are in their district. It gives them the number of beds, what their prices are, some star rating information. So just very high level, simple stuff. They can certainly go into this dashboard and look up more information on the hospitals. But here you go. There's the commercial break even, lots of room to negotiate here. And here is their trend for those 2 hospital systems. So it just gives them information. And then we wanted to put all the hospital systems in each state that are the highest, if you will, the top 10 hospital systems. So that helps them benchmark to say, okay, my hospitals are here. Maybe they're not the problem. Maybe it's, some of these other ones that are the problem. So they're all noted here for you by price. And we've got the median again at 253, and you can kind of just see where all of the hospital systems are. And then the last tab is just a glossary with lots of definitions, and we try to make this as comprehensive as possible, as you can see. So that is Sage Transparency, and I'm just so pleased you guys can use it, and I hope you do. And if you have any questions for us, we're very open to feedback. Thank you. I put up this slide because these slides are posted. There are a lot of fun features in Sage Transparency. The purchase data button, it's going to be coming in about 2 months. We're still building out that particular piece, but then you can select which hospitals you want information on. And I think if it's less than, Sarah, if it's less than 50, it's like $99. And so pretty reasonable prices. I know we're not going to be able to maintain it totally by ourselves, but we want to try. Again, the export, the collapsing button, and lots of other features there for you. We definitely want feedback. We do update it every quarter. There's a feedback button on there. Just put your comments in, we get it, and we'll review it every quarter and just keep making updates. Here's our disclaimer statement, which basically says, don't sue us. So, yeah, $5,000 for that paragraph, but that's what it says. I want to give sincere and special thanks to Sarah Adi. She's just, she makes everything happen in the forum, but she has been really taking the lead, along with Lauren Vella as lead on developing Sage Transparency. They work on this, they've been working on this for 6 months nonstop. So thank you both so much. Sarah Stewart, she does so much for us with looking at quality, giving us a lot of feedback. She's got that great eye for saying, that doesn't really make sense. That wording doesn't make sense. We need to reach, the colors don't make sense. So Sarah, where are you? Hi, Sarah. Thank you so much for all of your help. And Julie Reyes, she's not here, and she is our web manager. She just kind of makes it all connect. Quantify is our development contractor. So they're here today. We just want to thank them for being such great partners. We're on the phone with them every day. Every day. Every day we're on the phone with them. And they bring a team of people. I don't think I've been on a call with less than 15 people on their end. So it's a huge team of engineers and data scientists and whatnot. So we really appreciate that. And then, of course, all of our partners below.